Martin Seligman, What You Can Change and What You Can't, The Complete Guide to Successful Self-Improvement. Embark on a journey of self-discovery and improvement with Martin Seligman's What You Can Change and What You Can't, The Complete Guide to Successful Self-Improvement. This book summary explores the effectiveness of various treatments for mental health issues and sheds light on the limitations and misconceptions surrounding self-improvement. Delve into topics such as the role of genes in personality, the persistence of phobias, and the challenges of weight loss, while uncovering strategies to achieve a healthy mental state. This guide offers a comprehensive resource for taking control of what can be changed in our lives, while embracing and managing those aspects that remain beyond our control.
Rethinking Self-Improvement. The effectiveness of current psychotherapeutic and pharmaceutical treatments for psychological problems is often limited, with a success rate of only 65%. This is due in part to the heritability of problem-causing personality traits. People need to understand that some psychological problems may not be curable, and instead must learn to live courageously with their problems. The self-improvement industry often fails individuals by providing short-term solutions that do not address underlying issues. It is crucial to recognize what can and cannot be changed in our personalities. By understanding our psychological state, we can learn to deal with it and possibly change it for the better. Conquering dysphoric emotions. The ancient emotions of anxiety, depression, and anger haunt modern society. Humans can leverage their intelligence and biology to combat these emotions through natural methods such as meditation and progressive relaxation. It is important to remember to address serious disorders with therapeutic exorcism and not rely solely on temporary quick fixes like tranquilizers. The key message is to see these dysphoric emotions as bad weather and learn to calibrate them against the actual weather outside. Overcoming anxiety and phobias. Panic attacks, phobias, and obsessive-compulsive behavior can be cured. Panic attacks affect 1 in 20 U.S. adults, causing symptoms like heart palpitations, dizziness, and nausea, among others. However, people can learn how to control these symptoms with cognitive therapy. While some believe that panic attacks are caused by genetics or biochemistry, this view is generally incorrect. Phobias, on the other hand, have their roots in evolutionary history. According to therapists, there are 2 ways to treat phobias: systematic desensitization and flooding. In systematic desensitization, a person learns to cope with progressively scarier stimuli, starting with minor threatening experiences. In flooding, a person is immersed in a phobic situation and learns that nothing bad happens. This knowledge helps extinguish the phobia. Obsessions, which involve thoughts that play repeatedly in the mind, can bring people down. OCD patients may try to avoid dirt or ritualistically wash their hands to keep repetitive thoughts at bay. Treatment involves making these patients confront their fear and then preventing ritualistic behavior. Through this process, the person learns that nothing bad will happen even without the usual ritual, and this disarms the obsession. With therapy, people can learn new skills and techniques to combat anxiety, phobias, and obsessive thinking patterns. Ultimately, these conditions can be cured. Overcoming mental health challenges. Mental illnesses such as depression, anger, and post-traumatic stress disorder have become prevalent in our society. Depression, which is the common cold of mental illness, is generally caused by loss, pain, and sadness. Studies show that depression and bipolar depression have a hereditary link and can be treated with medication and therapy. Interpersonal therapy helps individuals with depression get along with others, while cognitive therapy helps them find new ways to think about loss and failure. Anger has 3 components: thoughts, bodily reaction, and attack, and can be triggered by the need to protect one's domain or feeling righteous. Badly socialized angry people tend to lash out physically, while a well-socialized angry person may lash out verbally. Repelling anger involves controlling the thoughts that set one off, and trying to see things from the other person's perspective. Post-traumatic stress disorder, PTSD, is characterized by repeated reliving of traumas such as rape or war experiences. Drugs and psychotherapy can help some people with the symptoms, but sadly, some individuals may not find a cure effective. In all cases, managing these psychological problems takes courage, support, and the willingness to function effectively despite them. Learning to embrace sexual aspects and overcome weight-related myths and alcoholism. This book discusses important aspects of sex, weight, and alcoholism. The 5 sexual aspects are sexual identity, orientation, preference, role, and performance. Transsexuals are psychologically trapped in bodies of the wrong gender, and exclusive homosexuality is deeply ingrained in the psyche. Therapy can alter feelings about sexual choice and preferences and help with poor sexual performance. Dieting is not effective and can be dangerous. People should accept their natural weight and exercise. Stomach bypass surgery can help the extremely obese. The book also dispels 4 weight-related myths. Alcoholism is not a physical pathology, and there is no addictive or alcoholic personality. Alcoholics can recover, and treatments like antabuse and AA can help. Overall, AA is marginally effective, but it provides a helpful substitute dependency that is not destructive. Inner child movement fallacy. The inner child, recovery, movement's belief that childhood trauma is the root of most psychological problems is misguided. Studies suggest that genetic factors play a more significant role in personality than childhood events. Considering oneself a victim of a bad childhood is unhelpful, and it's better to be forward-thinking and accountable for present identity. When facing psychological problems, therapy or drugs may help, depending on the issue's depth. For deep-seated issues, focus on changing aspects of personality that are amenable to change and avoid undue frustration over unchangeable ones. The Serenity Prayer advises accepting the unchangeable while bravely changing the changeable.
Seligman's What You Can Change and What You Can't is an essential guide for anyone trying to navigate the complexities of mental health and self-improvement. The book reveals the successes and downfalls of various therapeutic approaches and underlines the importance of understanding the root causes of our psychological issues. By contrasting conditions that can be changed, such as depression and anxiety, with those that are less malleable, like severe weight problems and homosexuality, Seligman empowers readers to identify areas of their lives with the potential for growth and change. Ultimately, this book encourages developing the wisdom to differentiate between what can be changed and what must be accepted in ourselves, leading to genuine transformation and well-being.